Hi, everybody. My name is Kylie McCall, and I did the occupational therapy observation shadowing experience, and I'm excited to tell you all that I've learned throughout this experience. So I shadowed Kelly Craighart in Leaps and Sounds Pediatric Rehab in Chardon, Ohio over Thanksgiving break. I observed multiple therapy sessions ranging from gross motor to fine motor skills and children's ages ranging from 0 to 21. I was shown how documentation is written and saved during patient appointments. Obviously, it was very seldom and small due to certain laws between patients and just confidential information between the therapist and the patient. I was also shown the flow and changes to the office throughout the day, like including patient turnovers and plans being written. And I was also shown a little bit of how to write, how an occupational therapist writes a plan and carries it out to their patient and caregivers at home. So I shadowed Kelly Craighart in Leaps and Sounds Pediatric Rehab in Chardon, Ohio over Thanksgiving break. I observed multiple therapy sessions ranging from gross motor to fine motor skills and children's ages ranging from 0 to 21. I was shown how documentation is written and saved during patient appointments. Obviously, it was very seldom and small due to certain laws between patients and just confidential information between the therapist and the patient. I was also shown the flow and changes to the office throughout the day, like including patient turnovers and plans being written. And I was also shown a little bit of how to write, how an occupational therapist writes a plan and carries it out to their patient and caregivers at home. So here is some small insight to their clinic. Their clinic is a small facility. It's a medical-based clinic, so all their therapists are certified. Um, and so it was just amazing to see, the influx of kids, through speech, occupational therapy, and physical therapy come through the doors. Each therapist kind of works together to create a positive environment for each of their patients. Um, there are definitely some very exciting and, interesting moments in the occupational therapy world. I observed a patient who had, a rough time coming into therapy, and by the end, they didn't want to leave and they just really enjoyed their time. And that was definitely a testament to me, showing that occupational therapists have a large role in the community and with the services they offer. Also into the clinic, it's extremely open, so there are kids running around from different therapies. There are kids receiving different care from different therapists. There's also kids from all ages running around, so there's definitely a lot to see in this clinic. Something that was extremely eye-opening to me was just the level of care the therapists give their patients. They treat every patient, as needed, and they just treat all patients how they want to be treated. And it's just amazing, from the youngest patients, that are learning how to walk, to the older patients who, need help cutting with scissors or writing with a pencil or trying to, button a button on their shirt. It's just truly an amazing experience to see. And I really enjoyed the shadowing experience more than I do in like the, hospital inpatient settings. This clinic was truly amazing, and it felt like a one large family. And I was super delighted and happy to be able to shadow this occupational therapist for this project. Hi, everybody. My name is Kylie McCall, and I did the occupational therapy observation shadowing experience, and I'm excited to tell you all that I've learned throughout this experience.
To begin the research aspect of the presentation, understanding the role of an occupational therapist is important. According to a research article by Allison Hammond titled "What is the Role of the Occupational Therapist?", the primary aims of occupational therapy are to improve people's ability to perform daily occupations, facilitate successful adaptations to disruptions in lifestyle, prevent losses of function, and improve or maintain psychological status. In other words, occupational therapists strive to enhance the lives of their patients by identifying ways to support daily activities from getting dressed to driving a vehicle. Interventions may include installing stair rails or access ramps in a patient's home or providing daily exercises to relieve joint pain. Other important notes are that occupational therapists support young individuals with disabilities. This can be further examined through an article done by Novak and Honan titled The Effectiveness of Pediatric Occupational Therapy for Children with Disabilities, a Systematic Review. Occupational therapy serves individuals across the lifespan, including children. The authors describe how occupational therapists support young individuals with disabilities. Because children with disabilities often face limitations in school, play, and social interaction, occupational therapists provide tailored support to help them participate more fully in daily life. Overall, analyzing the role of occupational therapy for disabled individuals in schools and hospitals shows that these interventions have the potential to improve independence, daily functioning, and overall quality of life. Diving into research paper number 1, titled Potential Role of Occupational Therapist Intervention in Elementary School for Children with Additional Support Needs, a Systematic Review, the authors conducted a study analyzing occupational therapy services for children with additional support needs or disabilities. Many students require accommodations and academic support due to learning difficulties, and occupational therapists play a key role in helping these children achieve success. Their systematic review examined 8 major research databases and categorized the findings into participation-focused interventions, literacy-related interventions, and educational models and sensory/self-regulation approaches. Across these categories, occupational therapy interventions supported students in various ways, such as improving sensory regulation, providing behavioral support, and strengthening fine motor skills. Although further research is needed, the review indicated that interventions increased classroom participation, attention, and independence among children with disabilities, ultimately improving their overall school engagement. Moving into research paper number 2, titled Physical and Occupational Therapy Utilization in a Pediatric Intensive Care Unit, we can see that the role of occupational therapists extends to hospitals as well, which in this case, the study is looking at pediatric patients in the Pediatric Intensive Care Unit at the Children's Hospital of Pittsburgh. In this study, children ranging from 2 weeks to 18 years old who were admitted for more than 3 days qualified for inclusion in the study. For each patient, researchers collected information such as age, sex, race, and primary and chronic diagnosis. After therapy consultation orders were placed, researchers recorded the timing of therapy, session duration, types of therapy provided, and reasons for deferral. The goal was to better understand how therapy was utilized and assess its effectiveness. Results showed that children with poor functional status prior to PICU admission were more likely to receive therapy consultations, helping explain why fewer than 1/3 of PICU patients ultimately received treatment. Although the study did not demonstrate clear long-term outcomes, it confirmed that both physical and occupational therapy are safe forms of treatment for critically ill children. Therapists provided assistance with passive range of motion, active movement, and various activities of daily living, contributing to improved comfort and function.
Okay, so for research paper number 3, the article that was conducted was the interrogation of occupational therapy into primary care, a multiple case study. This case study investigated how occupational therapy is integrated into primary care settings and what structures and processes support integration. So how occupational therapy could integrate into hospitals and primary care places as such. And it addresses a gap in real-world examples despite growing interest of occupational therapy and how it benefits patients. There were 2 propositions that helped to guide the study. Successful integration depends on team understanding of what exactly occupational therapy is and supportive team structures, and also the electronic medical record system, and that's key to enabling the integration of OT into primary care systems. The study used a multiple case study design for 4 family teams, collecting data through interviews, documents, and questionnaires, and analyzing each case before comparing them through a pattern matching approach. At the end of the study, it was shown that strong teamwork, shared programs, trust, and communication, supported by tools like the electronic medical record systems, helped integrate occupational therapy more effectively into the primary care systems. Occupational therapy integration worked best when services were embedded into existing programs and workflows, and when therapists engaged with different populations, particularly older adults. With all of the articles and information that was gathered, we connected it to our shadowing experience. So specifically in the results from Article 3 aligned with the shadowing experience, where collaboration, communication, encouragement, and individualized care were key factors in creating effective and positive sessions. Each treatment plan is specific for each patient, and we've also seen in the shadowing experience that even when patients are having a hard time with their treatment, some positive encouragement and just communication with the patients and their families goes a really long way. The staff's personable nature and attentiveness to each child further enhance the therapeutic experience, creating opportunities for children who require additional support to explore and develop strategies that help them adapt to their unique ways of living. Also, the combination of encouragement and communication shown by occupational therapy pushed the children to overcome evident struggles in their session and finish the sessions stronger than they started. Again, with the encouragement is just a huge factor. Kids really bounce off of that. They just need someone to believe in them, and they are willing to put in the extra work. And then with the assistance of occupational therapists, as seen through both of the authors and 2 of the articles, the overall quality and outcomes of patients' lives improve, and it helps them gain overall confidence and skills learned.
Hi everybody, my name is Kylie McCall, and I did the occupational therapy observation shadowing experience, and I'm excited to tell you all that I've learned throughout this experience.
For our interview, we interviewed Ava's mom, Miss Lindsay Biddlemeyer. We did that December 8th, 2025, and it was via phone call. We obtained information into what a typical day of an occupational therapist is like. We were educated on another aspect of occupational therapy, which is community-based occupational therapy, and what that was. And we were also provided with information on how to be successful in the occupational therapy profession. Some of the questions that were asked during the interview portion was, how did you choose this profession? What education and training did you need? Are there any special certifications that would need to be obtained before doing this occupation? What is a typical day like, and what can I expect? What are main responsibilities, and what types of people do you work with? What age ranges? What do you most like about your job and dislike about the job? What skills or personal qualities do you think are most important for success in occupational therapy? And can you describe a particular rewarding or memorable experience you've had on the job that kind of sticks with you? And do you have any advice to anyone like us college students that are just starting out in the field? This connected from our interview and research. In the interview portion, there was insight gained into what a typical day in the life of an occupational therapist is. And we learned information about community-based occupational therapy and how it is to be successful in the occupational therapy field. So this connected to the articles, especially with the article about the children and the disabilities and how they use occupational therapy. Their tasks are limited, especially within their community, like going to school and using the playground and just stuff like that. So having them do community-based occupational therapy could help them adapt more to their surroundings and their environment more effectively. Also, the community-based occupational therapy learning relates to the research by helping patients feel more comfortable with their skills and gaining independence in their own communities. With the skills improving and going through the occupational therapy, it helps those patients and students feel more comfortable and makes their engagement in school and other environments that they have to navigate more comfortable. So it also improves their engagement within their school.